I'm a plastic surgeon and I live and work in Milan, Italy, north of Italy. Today we will do a resurfacing of this very nice patient that has a skin type 4. He born in Latin America, and I decided to do a treatment like the one suggested by Dr. Almeida that works in Brazil. We applied 1 hour ago an anesthetic cream, and now we have to remove that. We remove the gauzes. Okay, that's perfect. Thank you very much. And then we remove the plastic drape that we applied to do an occlusion application of the anesthetic cream. Then we removed the anesthetic cream with the dry gauzes. Now we will apply the protection for the eyes. These are some protection of the eyes that has inside a metallic plate, so we perfectly protect the eyes of the patients. Now, this is the first screen of the Encore laser, the only ultra pulse laser in the world. We select aesthetic, then we will use a DeepFX handpiece. Now I will decide the pattern, the shape of the laser, the dimension, number of pulses, and naturally the density. I will use density 10%. That means ablation of 10% of the skin, and I will use a very large square shape to treat as fast as possible the skin of the patient. Then I will decide the energy. I will use 20 millijoules. I will use a repetition rate of 0.5 seconds. That means that between one shot and the other there will be half of a second. And always I use 300 Hz of frequency. This is, I think, is good parameters for the cheeks and the temple areas of the patient. So we will start. Now the device is ready. So we'll start on the right side of the face of the patient, and my nurse will help me using a dynamic cooling device. I will start. How is it going?
Yeah, it's okay.
That's okay, perfect. This treatment needs a lot of concentration because you have to put one shot exactly near the other. The first tip of this demonstration is how to follow the jawline. I suggest to put one finger along the jawline, so you have your finger that will explain exactly where you have to work. As you can see, I put my fingers along the orbital rim, so as along the jawline, I exactly know where I'm working. Okay, that's fine. I will start again. I will stretch the skin, and this is very important. It's the third tip of the day, because stretching the skin, we will transform the skin in a more thinner layer. So I then apply again my finger along the jawline, and I will start again to do the treatment. Patricia, can you block me the arm of the laser, please? Thank you. Alright. I put my fingers along the orbital rim and I will treat the medial part of the cheek. Now we will change the parameters. We will reduce the energy, maintaining the same density. I will reduce the energy to 15 millijoules, and I will treat the forehead, the chin and the nose. We will treat the chin, eyes. I will remove the protection. I use the hood on the presser because the hood is metal, is not plastic. So one shot here, immediately the second one, and there's no risk to hit the eye. Then treat the lateral part of the nose without moving the nose. But when you have to treat this area, you have to move the tip of the nose to have a flat area treatment. But as you can appreciate, the area that we treated before, the cheek, there's no more bleeding. We have some oozing and naturally a great edema of the skin. I want to thank you very much, and I hope that this movie will be helpful for you. Thank you very much, and see you again. Bye bye.